Hi, this is Randy. So I ran out of time on the last video about therapy and therapists. I just have more to say on this. Okay, so here's the perspective. When you're coming in with all of these trauma symptoms, you've experienced PTSD, but you don't necessarily maybe even know that. You want the therapist to listen to you and understand how you were abused, not just abused, but how you were abused by a narcissist. Well, if you were to go to a forensic therapist, if you were to go to a person who specializes in personality disorders, possibly domestic violence, okay, and you just talk about your narcissist, they would be most likely to understand what's going on with the narcissist. Like, they would know the most about narcissism and personality disorder itself. They would probably believe you, the stories that you're telling about how the narcissist in your life behaves. They would probably be able to, hearing enough about it, they'd probably be able to decide, yeah, you're dealing with a narcissist. But they specialize in the personality disorders, not in the people that live with the personality disordered people. So they may be able to empathize in a way or provide validation in terms of believing you and basically, diagnosing the cluster B from afar, not the person sitting in front of them is presenting that, but the person in front of them is basically telling these stories. And then in the therapist's mind, they know enough about the disorders just to be saying to themselves, oh yeah, this person's dealing with a cluster B. That does not mean that therapist knows how to treat you. It just knows they know how to identify who you might be dealing with. If you go to just a therapist who understands about trauma, PTSD, let's say suicidal thoughts, sleep disorders, self-abuse, obsessive compulsive disorder, rumination, grief, loss, marital counseling, family issues, behavior problems, did I say depression? Dissociative disorder. You go to a therapist that understands those, they'll understand you, and they'll be able to diagnose you as a person who's going through trauma and having these symptoms. But when you try to talk about the mind fuck and how you weren't like that before and you are now because your narcissist is the one who created your mind fuck and your symptoms, it's like they don't have that narcissist or personality disorder person in front of them, and likely they know that the treatment for that person is pretty scant. So they're going to try to focus on you. What can you do to help your own symptoms, to change your own symptoms, to increase your functioning level? Every time you talk about the narcissist, they're like, that's not their specialty, is understanding cluster Bs. Their specialty is understanding somebody who's sensitive, who's responding to a trauma situation. So do you see? Narcissistic abuse therapy and recovery requires an ultimate specialty in several areas in order to understand both the narcissist cluster B, your trauma, your symptoms. They would need to understand both and the mind fuck of it all, how it affects your brain. So, and this is new, it's too new. That's why therapists don't know it. They don't specialize in these multiple areas, because basically you want them to understand the narcissist. So you want them to specialize in criminals and sociopaths. And then you also want them to specialize in trauma treatment and those people that are affected by them. And you want them to understand the correlation, like how it works. And the reason they don't, because there's no study on it, and the only ones that are going to are the ones that actually experienced it for themselves firsthand. Or if there's any, new training. And, as I heard Mark Smith say, he just went to a national trauma conference, and they never mentioned narcissistic abuse in the whole national conference. They were just talking about the presenting person and how to help trauma, period. But that special kind of trauma that you get from the long and short-term devastating relationship with a narcissist who puts you through that fatally flawed loop, or who raises you, you need a super special kind of therapist, one that has been through it or has studied it for a long time. And you're not going to find anybody who's studied it for a long time, because we are at the infancy stage of it. So stop ragging on the therapists for not getting narcissistic abuse. Do you understand now why they wouldn't? I mean, the standard that people hold up to about therapy is completely a fantasy in their mind about their expectations, and that they are constantly disappointed because their expectations are totally off the charts. If you know and understand specialties, areas of concentration, okay, so lighten up on the therapists, lighten up on the psychologists and the therapists in the field who are now trying to make some money because they do understand it. Are you going to rag on them too because they're trying to make money? These few that are on YouTube and that write books that might make some money on their book, or that might make some money on a plan, a program that they have for you to recover, and they're like these pioneer, groundbreaking people. You gonna rag on them? Criticize them for making any money at all? I mean, how do you expect someone to devote their life to a new field and become a groundbreaker in it, but totally not make any money on it? Just do it on the side of the goodness of their heart. Would you do that? I hope you think about this. Thanks for listening.